everybody. Welcome to the feed today. Welcome to our new audience and also those of us that are with us weekly. We love you. We care for you. And this show is actually for you. The Faces of Epilepsy Every Day, which is the feed, is hosted by myself, also Alyssa Servideo, and our producer is Michael Hall. We are so excited that God is just moving. He's doing amazing things. So I'm a little concerned today because I was talking to Michael and Rhonda right before the show that a little juvenile mockingbird has seen fit to fly right over here into the kitchen. And I can hear her going on and on and on, trying to get out of this house right now. So we have a lot to unpack today. But before we do that, because I am a little distracted by her in the background, I just want to say we're still giving away these beautiful beanies by Love Your Melon. They are actually beanies that are made for cancer patients, but they have seen fit to partner with Faces of Epilepsy to give these beautiful beanies away. So don't forget to go to our Facebook page, which is facesofepilepsy.me. It's a community for you. We're almost at about 1,900 in that community. And it's really awesome what God is doing in there. And then the other thing is then when you like and you comment, you subscribe, and you get involved, you can win these beanies, okay? Free to you, and we'll mail them to you. So thank you, Love Your Melon, for those. The other thing that I wanted to mention to you is we do have a book coming out. It's called Surviving SUDEP. So we still are looking for interviews. If you believe that you have a story to tell that can add value into our epilepsy community, then we want to hear from you. So please make sure that you reach out to us so that we can interview you right here on the feed. So today we have an exciting guest for you. It's actually someone that I've known personally for many, many years, I think over 30 years, actually, probably at this point. And I actually got to see her a couple weeks ago in Fullerton, California. She's out of Orange County. She is a doctor of psychology. Her name is, I'm going to leave that for just a second, but I want her to come on and I want to talk about today all things mental health related with regard to epilepsy, though this is very, very important. So let's grab your hot tea or your hot beverage and your notes, because it's going to be a great interview with Dr. Rhonda Gordon. Rhonda, are you there? My good friend in Orange County.
Hi, good to see you.
Yeah, I'm so excited to have you on because I know you are so busy. I mean, you are, oh my gosh, I have chills all over my body because just of all the things that you are doing for patients, specifically in the area of chronic illness. And when we met up a few weeks ago in person, I said to you, is there any way possible that you would be willing, and I think it's been almost a month now, but the days are sort of running together. I said, is there any way possible that we could bring you on just to talk about mental health? Because this is your specialty with regard to chronic illness. And even though you're not an epileptic, you do have a lot of patients with chronic illness. And I believe that you could add great value to what we're doing here at the feed. So thank you so much for being on with us today.
Great to be here.
Yeah. So I wanted to get into some of the statistics, first of all, just so we can kind of lay the foundation for our audience. Studies show that 1 in 3 people with epilepsy will experience a psychiatric disorder in their lifetime. Depression, which often goes misdiagnosed. Epileptics are not diagnosed at all with depression, even though they have a 3 times higher rate of that. Affects roughly 30 to 50%, and anxiety can impact up to half of those living with the condition. Also 3 times higher suicide rates with epileptics. There's also a 20 to 30% of people with epilepsy that are actually living with an anxiety disorder, whereas roughly only 7 to 10%, that's an alarming statistic, actually, when you think about it, of the general population. Okay, I want everybody to hear that 20 to 30% of people living with epilepsy have an anxiety disorder, whereas only 7 to 10% of the general population do. And then people with epilepsy are 2 to 3 times more likely to experience depression than the general population. Also, 60% of people with epilepsy report experiencing stigma or discrimination. Up to 50% of depression cases in people with epilepsy go undiagnosed or untreated. That's a very sad one. And then also, studies suggest that up to 25% of people with epilepsy show symptoms consistent with PTSD. This is alarming. And I know that we're kind of getting right into it today because this is a big issue, obviously, doctor. And you see,
Yes.
I'm sure, in your practice. And what do you think about all this, with everything that you deal with chronic illness?
Yeah, usually when a person has a chronic illness, it comes with a lot of anxiety. And when you're living with anxiety for a very long time, after a while, you become mentally fatigued and then it turns into depression and hopelessness. So I'm not surprised that people are feeling this way at all. And then because of the stigma, it's, especially I want to say for men, but in general, the mental health stigma of admitting that you're depressed. I do get a lot of patients that I do questionnaires with and evaluate, and they have very high depression scores, but they've never even known that they were depressed. It never even occurred to them, but they have all the symptoms. So there's the depression of not being able to control the situation the way that they would like, and then the anxiety of when is the next time I'm going to have an episode, or maybe even a phobia of being out in public and something happening. So there's a lot of different areas. So therapy would be really good to talk about those areas and process the trauma from past experiences and process the fears from the future experiences
When you
that,
say
that are, yeah.
therapy, that can also be a very taboo subject. So this sounds so layered as I hear you
Mhm.
speaking because of the anxiety piece and the depression piece. Is there an order to this? Meaning, is it the stigma and the shame, and then the depression, and then the anxiety, and then because oftentimes what we find on the show is that a lot of the people that don't really know about what epilepsy is they think it's just seizures. But there's a
I see.
huge piece to this with regard to the mental health. And
Yeah.
that's why we're so glad to finally have you on today. Is there an order to this? Is
Yes.
there an actual order to how this kind of rolls along?
Yeah, I mean everybody is different in their makeup of how it'll, show up for them. But I do think it is very important to be able to express your fears and your feelings to somebody, at least one person in your life that you can trust. And then if a lot of people don't have one person, so that's where therapy would come in. Although I mean some people do have people in their life, but they're tired. They feel like they're always having to count on them and they don't want to burn them out. And so therapy would be another way to bring in another layer of support. And it's not just the person with the chronic illness that needs therapy, but also for the caregiver, because there is such thing as caregiver burnout as well. And so it does take a toll mentally on everybody involved, right? We're society. And so when one person's affected, the family's affected, the community's affected in different ways. And so everybody needs support. And and so yeah, it depends. Some people will have anxiety first and depression later. I think depression sets in more when there's a feeling of hopelessness,
Mm-hmm.
that things are not like a pessimistic view of the
Mm-hmm.
future. And so
Mm-hmm.
we need somebody to come in there and also remind the person of the glass half full versus half empty, right? It's very hard to be very focused on the empty part, and we need
Mm-hmm.
people in our lives to remind us of the full part too.
Yeah, I love that you said that because also to the caregivers, how important it is for them to also get therapy if they need it,
Yes.
or to have
Yes.
a sense of community I never had any of that. I didn't talk to anybody. We just kind of dealt with it. I think most families, Dr. Rhonda's, they just kind of deal with it. And do you find that in
Exactly.
chronic illness that the caregivers, as well as the people that have chronic illness, just kind of deal with it?
Yes, I think a lot of people deal with things and they feel that they're alone in it, and they don't realize that there's a lot of people that are going through the same or similar things. And
Mhm,
that's why, this podcast is fantastic because it gives people a sense of hope that they're not alone in this, right?
mhm,
Um, I usually work with the person with the chronic illness, but I'll be in
mhm.
touch with their spouse or their caregiver, and I'll really highly encourage that they join some kind of support group. And there's tons of online support groups for caregivers, but a lot of them are very reluctant to do that.
Yeah.
But one thing I have noticed from being a therapist for so long is that I'll have somebody come in and they'll share their feelings and they feel so alone in it. And then, I'm logging off and going to the next person and they're sharing almost the exact same things, same words and everything, and feeling alone in it. And so I think it's important, to reach out to people and realize that you're not alone in this. And even just to have somebody to listen is really crucial.
Yeah. I definitely believe that. Do you feel like this is a societal burden being in the field that you're in? What do you
Hmm.
Oh my goodness gracious. I'm trying to articulate this question the right way because mental health is such a big piece of why our society and culture is where it's at right now. Suicide
Yeah.
rates, attempted suicide rates with young girls, the number one community
Mhm.
of attempted suicide is young women between the ages of 12 to 18. And I think about that and I wonder how much culture is a driving force. I'm wondering if there's a
Mhm.
piece there for epileptics. Like, is there certain things that maybe they should do or stay away from culturally that will cause them to focus on that cup half full?
Yeah, I think you have to do some stress, kind of some kind of de-stress every day
Mhm,
is really important, right? In doing some mindfulness and the here and now, meditation, prayer, self-care, self-compassion is really important. I do think our society is very hard on
mhm,
ourselves. Most people do not have a lot of vacation. They're living paycheck to paycheck.
mhm,
So there's
mhm,
a lot of stress when you don't feel good. It's really hard to go to work. If you don't go to
mhm,
work, you're in jeopardy of losing your job. So I see a lot of people that are struggling. Like some of them cannot go to work at all ever again. And then that leads to depression of their identity. Um, Trying to prove that they have a disability. One thing that comes up a lot in therapy is, I had a picture. I wish I should have showed you the picture. It's like disability doesn't always look the same for
mhm,
everybody. And it's a picture of like somebody in a wheelchair, somebody with a cane, and somebody who looks absolutely normal on the outside,
yeah,
right? And so people will tell me, I look
mhm,
great on the outside and I'm smiling, but on the inside, I'm
mhm,
screaming and I'm crying for help. And
mhm,
my employer's like, just get to work and tough it up. But they're really not feeling good. But it's
mhm,
hard because they look fine on the outside. So people are just like, get over it, right? And so
mhm.
we need a lot more compassion for ourselves and for others.
Yeah, I love that you said that because at the beginning of the year, and when I first started to go down this path with Faces of Epilepsy and then partner up with Mike on this incredible podcast, and thank you so much for just acknowledging that, validating the work that we're doing here because it's all volunteer. Mike's a volunteer, I'm a volunteer. All the people in the groups, we're all volunteers, all the moms, none of us get paid for any of this advocacy and we're not even raising money really, so um, it's interesting that you said that and acknowledge and validate the fact that why this was started is so that people don't feel alone and they feel like there's other people kind of battling, with the same things. The other thing is that when you mention that, people are like kind of they go to this place where epilepsy, like you can't, when you look at somebody with epilepsy, they just look like beautiful and like everybody else, you know, they don't really look like anybody, you know, like you said, it looks different, you know, chronic illness would be a cane, a handicap, and this, that, and the other. Epilepsy is not really obvious. It's just not.
Right.
People don't even know it. I mean, it's just crazy to me that you can meet people, and then there's all these famous people that have epilepsy, doctor, that everybody's like, oh my gosh,
Oh,
had epilepsy. Cameron Boyce had epilepsy. What are you talking about? You know, Neil Young and like all these artists, Susan Boyle from America's Got Talent. I mean, you know, all these people that have epilepsy, Danny Glover, you know, and a lot of people just don't even realize how many people have epilepsy because it's not obvious, you know.
right.
How can people deal
Yes.
with that have epilepsy? What can they do to you know to let people know I'm not okay, you know, sometimes, you know.
Yeah, I think it's hard. You have to know who you can trust, right? Sometimes you don't have to share with every single person, right? Like I have absolute epilepsy, but you do want some people that you can share the struggles with. And that's really important because if you don't share your feelings, they're going to come out in other ways. And it could be panic attacks, it could be headaches, stomach aches. So it's really important to talk about your feelings. And I know that's really hard, especially in certain cultures too. It could be taboo, right? Like to say I'm afraid, it doesn't sound macho, but the truth is that the more you talk about something, the less it'll be in your mind. So you mentioned PTSD. So in
Yeah.
PTSD, you used to think if somebody had a traumatic memory, don't talk about it, so then they won't be upset. But actually, the science shows that if you talk about something, it becomes smaller and smaller in your brain. So let's say you had some kind of traumatic experience where you ended up in the hospital or something where, and sometimes it's embarrassing too, right? If it happens in public or what, but if you talk about it, when you first talk about it, it's going to be very upsetting. You might even be shaking when you talk about it. The next time you talk about it, it may get a little easier, and each time it'll get smaller and smaller so that we're not forgetting the memory, but we want to get it to a place where the memory doesn't have a hold over you anymore and cause bodily symptoms. If you don't talk about your fears, they might come out in dreams and nightmares and other things, or avoidance, of people. So I mean, there's so many ways it could come out negatively, or addictions. So we want to make sure that we communicate to the right people that you trust and say, you know what, this is really hard. I'm going through this. It's really hard. And just to have somebody almost like, not physically holding your hand, but in an emotional way, holding your hand and being like, I care about you and I'm going to be alongside you for this journey, I think is really important.
Wow, that's like really, really valuable advice right there. That is really valuable to our audience today. If you just heard what Dr. Rhonda said, please take note of that. Get around somebody that you can trust and talk about the way you feel. If you're hurting, say, I am hurt. I am confused. I am disappointed. I am frustrated, because that's not something we really did. Like I said, we just dealt with it. We just dealt with it.
Yeah, and you might have been in survival mode, and there's a time and a place,
100%. Yeah.
right? So there's a time and a place where sometimes you're just in survival mode and you're just trying to do the next thing. And then there's a time where you have to step back and process what happened. And sometimes people are so in survival mode for so long that they don't have a chance to step back. And then when they do step back, that's when it really hits. So for a lot of people, when they have some kind of traumatic experience, it'll hit them after it's all over, when they're resting. And there's a whole science about your body getting the message after the brain gets the message that it's safe to relax now. So the body kind of catches up after the brain does. So, there's a lot of things you can do. I've done EMDR with some people that have epilepsy. I've done you could do cognitive behavioral therapy as well, but it doesn't have to be a professional setting. It's about talking to people that you trust and not feeling like you're alone in it. And then self-care is so important for everybody involved, to take time for self-care and not feeling selfish if you take time for self-care. Because I think that's another thing I hear often is
Mhm.
people saying, I feel selfish if I
Mhm.
take a rest for 30 minutes, or if I, take a vacation or something, they feel like
Mhm.
they're selfish. But actually, I tell them that by doing that, you're actually helping the person that you're working with, because they need you to be healthy too,
Mhm.
or else you're
Mhm.
both not good for anything. So
Mhm.
taking time for self-care is not selfish. It's part of it's helping you and helping all those around you, and
Isn't
loving
that
others
awesome?
around you.
What is EDMR? I can imagine that our audience, when you just drop that little nugget, what
Oh yeah,
exactly,
yeah.
what is that, for the audience, that doesn't know what that is? What is that?
Yeah. So EMDR is eye movement reprocessing, and gosh, I forgot the D's now. I'm
That's
having a
okay.
blank on the D. But it's desensitization. I'm sorry, desensitization. So EMDR, you can work on past, present, or future issues. So like I had a person, I know you said it's not just about having seizures, but
Right.
I had a guy that he had a seizure at the dentist's office, so now he's afraid to go to the dentist's office, right?
Mhm.
So we did eye movement. So you can do it with I have a little wand here. I know, so it's not hypnosis. It taps into the left and right side of the brain. You can also do it with butterfly tapping. Um, and so we did some processing of the past experience, because he had a fear of seizures.
Okay.
And so we did the processing of the past. We did, and then we also imagined that he was back in the dentist chair, and we did some processing of the future and what he needs to get through, the courage
Mm,
that he will need to get through that. So there's different things that you can do with EMDR that's a little different than regular talk therapy.
mhm.
It connects the left and the right side of the brain. So the left side of the brain's like your logical side, and your
Yeah.
right side is
Mhm,
your
mhm,
emotional side.
mhm.
And so it's kind of like getting your logical side to talk to your emotional side and tell it truthful statements and counteract lies that you've been telling yourself. So it's very powerful. And it takes the fear memories from the past. Like, let's say you're thinking of, like, I know you had a very traumatic experience
Yeah.
with your
Yeah.
son. If I
Mhm.
if I can use him as an example,
Yes,
like,
please.
I'm sure when you think of it if I said, okay, from a 10 out of 10, how upsetting does that feel? On some days it might be a 9 or a 10, right? I'm sure
Mhm,
most days it's a 9 or 10. And
mhm, mhm.
then EMDR would get it down to like a 0 or a 1, where
Mhm,
you can still talk about it, but you won't have the shakes in your body, or you won't feel
mhm,
your stomach
mhm.
hurting, or things like that.
Yeah. What a good point, because like and I know that you've known Judah since he was born,
A
basically
baby, yeah.
yeah, a baby. So you've known our family for a long time. And I know that was, yeah, it was, I didn't, it's interesting because when I first went through it, obviously there was the big shock, but you're right. My body did not catch up with that. I was sort of like, felt like I was floating that first week. I was
I
still
bet.
like numb, even like still doing business and all this other stuff. But when
Wow.
my body finally caught up, I remember I was in Escondido in a timeshare, and I didn't wake up for, I think I slept for, I felt like 14 hours, 15 hours, and
Wow. Yeah.
I slept for days. I didn't want to get out of bed because of my body. I think my adrenals, or something were so burnt out, just from the shock
Yeah.
and processing. My brain, and we have a big audience of moms and parents that have lost their children to set up, so they could
So
probably relate
sorry.
to this. But I don't quite understand this. Maybe you could help guide us through this process. But it felt as a mom that I was going through my son's birth, his life, and his death all at the same time. It was like my brain would just be
Mm,
running it over and over and over and over again. And it wasn't until I
yeah.
actually listened to subliminals at nighttime that helped shift the brain just enough. How much does
Mm,
mental health play a piece in the brain, you know, being able to rewire itself. Does a lot of the work that you do, it sounds like a lot of this is rewiring the brain and the way
Yes.
the
Yes.
brain actually functions. I'm like
Yes.
wondering if, you know, because seizures, it's all neurological, right? I mean, autism, you know, epilepsy, MS, cerebral palsy, you know,
Mhm.
ALS, dementia, Alzheimer's. Do we even look at mental health, I guess, as a way to, I don't want to say cure, you know, but help us to kind of get through it through therapy. Like I'm wondering if
Yes.
this is a big piece that needs to really be looked
Yes. Oh, no, totally. Yeah, and it's a tool, right? And you know, some people might help in one area and some people might help in another area. Um, in EMDR, if they've done studies where if you were to take the brain and put it under an MRI and do the EMDR, you will see a shift. So the amygdala, which is the front part of the brain,
at.
when an emergency happens, it lights up, right?
Mhm,
The emergency, it's like your emergency in your brain, an alarm.
mhm, mhm,
But when the emergency passes, it's supposed to shut down. When you're in a state of constantly always having to have that turned on over and over again, after a while, it doesn't know how to shut off on its
mhm,
own.
mhm,
And so therapy and stuff like EMDR teach this amygdala that it's okay to shut it off now. And what they've noticed under these you know, views of the brain while doing EMDR is that the traumatic experience that whatever it is that you're describing, will shift from the amygdala to a more positive part of the brain. So not only is it working on a surface level, but it is, like you said, rewiring of the brain. It's also, they talk about trauma being stored in the nervous system.
mhm,
And so
mhm.
EMDR actually, it's like getting it out of the nervous system. So yeah, there's so many different components to this. And you know, and everything's connected. The body and the mind are, I believe, are one, where it's all connected. And they've done studies now about gut health and how it's all attached to the brain. So a lot of people might have, you know, if you have a lot of GI, you know, issues, it's probably related to mental health.
Mhm. Does this mean everybody, caregivers and epileptics and those with chronic illness, should be in therapy? Like they should be doing these processes to help them if they're not?
I mean, I know not everybody can afford therapy, and so there are different ways to get support. You know, some churches have like peer support, and if that's what you can get, you know, just get some. I would say get something. If you can only get an online support group, you know, that's free, then
Mhm,
do that. I mean, most insurances do cover therapy now, but you do want to get somebody who specializes in these, you know, specific topics, because they'll be better at being able to help you. I mean, everybody has different focuses, so it's
mhm,
good to get somebody. A lot of directories, you can actually see what the specialty is and then, you know, pick somebody that
mhm,
is focused on your specialty that you need. I'm not saying it's the end all, right?
mhm.
Like there's different ways to get help, but it is a very big tool that would help a lot of people.
Okay. What was the second one that you said right after that one? You said there was another type of therapy that you do with also people
Oh,
chronic
yeah.
illness.
So, cognitive behavioral therapy, which is the reframing of negative thoughts. Um, Now, there is a component of that in EMDR as well. So, for instance, a lot of times when I do EMDR with people, they will say that the negative thought that they have, we'll think of a traumatic experience and then a negative thought they have about themselves today
Mhm,
in relation to that memory. So, the negative thought that comes up a lot for people is I should have done something different. I should have done something more. It's
mhm,
my fault. Those are like the three
mhm,
big ones, or I'm in danger. If they're anxious, that might come up too.
mhm,
Um, and so in cognitive behavioral therapy, you're just redirecting these negative thoughts and challenging them and into more truthful statements. EMDR does also the same thing. So by the end, I want the person to believe I did the best I could under the circumstances. I did the best I could at what I knew at the time, you know? things
Mhm.
like that, to kind of, and really to believe it 100%, not to just say something that I'm telling you to say, but to really believe it 100% from your inner being, that I
Mhm.
did the best I could under the circumstances, or I'm doing the best I can with the resources I have. That's another good one.
Yeah.
Or,
There's a
and telling your body it's safe to relax now. Sorry, that was the
That's
last one
good.
I
No,
shared.
no, that's good. That's good. That's
I always
excellent.
have people tell your body. So we'll do some EMDR with slow butterfly taps with
Mhm,
their eyes
mhm.
closed. And
I
I
love
will tell people to tell their body it's safe to relax now. And that's something that anybody can do. You don't have to go to therapy to do it. It does hit the vagus nerve. If you just close your eyes and you can do some breathing and just some slow tapping and just tell your body it's safe to relax now. The danger has passed.
It's safe to relax now. The danger has passed. That's so good because, we often see in the epilepsy community, the caregivers, as well as the epileptics, have a fear constantly and an insecurity back here. So you're constantly in that fight or flight. That
Yes.
sympathetic nervous system is highly charged. It's very hard to get into that parasympathetic, heart center.
Yes.
And that's why I'm like, this seems very purposeful, like very mindful that
Hmm.
this is something 50 million epileptics need to be doing worldwide. They need to be doing this
Yes.
worldwide. They need to be learning these breathing exercises and different ways to get themselves back into their body because they're way out
Exactly.
here in all the crazy. And
Yes.
the other thing is that a lot of people will talk about on the show that they're on medications that cause them to have Keppra rage. We hear about it
Mm.
all the time in the groups. Keppra rage. And it's where when you take medications for your epilepsy, Keppra is a medication. There's also Depakote. But there's this thing with Keppra rage where people take it. My son Judah was on it when he was 14, and then they wanted to also give him psychiatric medications as well because bipolar is a trigger for seizures. They're it's an inhibitor for seizures. Is
Um,
bipolar. So oftentimes people will be on these psychiatric drugs and different things like that, and it will completely change their behaviors. What would you say to
mm.
people? With we just have a few minutes. I know you got to get to a patient, but and we're so grateful you've just been amazing today. I mean, gosh, we could go on and on for the next 3 hours, and I'm sure Mike
Yes.
wants to get in here and ask some questions. So we're definitely going to have you back because I would like to have you back, even talking more about the suicide statistics because that's huge, and maybe we could do a whole show around
Yes.
that. But what would you say to people that are taking medications and they are just not the same people anymore? They are angry. They have these Keppra rages.
Mm.
They're not motivated. They just want to sleep in bed all day. There's all kinds of different
Wow.
people like that. What would you say to them?
Yeah, I definitely think anybody who's on any sort of medication definitely needs to be in therapy because, it needs to be monitored.
Mhm.
And, you can work on anger management, but it sounds like it's not, it's very difficult for them to manage. The caregiver definitely would need to be in therapy. I mean, no doubt about it. They're going to need some support, to not take it personally when they're seeing the person have some sort of rage. And also, it's hard to watch somebody you loved go through those kind of up and
Mhm.
downs. I
Mhm.
can't imagine how difficult it is. I know I've had patients where they didn't want to get out of bed and their spouses would call me and say, please help me to get this person out of bed. And it's hard because sometimes you cannot, they're not children, and or I mean maybe they aren't, but some people are adults, but you can't like drag them out of the bed, right? They have to be able to get out on their own. And so remembering what you can control and only focusing on what you can control and releasing what you can't control is very important. And acceptance is part of a grief process, right? So there's the negotiation part of grief where you're thinking, if I do this, then maybe this will happen. Or if I do this, then maybe things will get better. But then the reality of like, okay, this is our reality and I have to accept it, that this is our new reality. And that's
Mm.
difficult. Yeah. And give yourself time to get there.
Yeah. What I'm hearing you say, and I heard you say it a little bit earlier, is don't be so hard on yourself. That was a big word
Yes.
that we had for the epilepsy community at the beginning of the year, is really take it easy on yourself. Take it easy on
Yes.
yourself. That's what I'm hearing. I'm also hearing that, your therapist is like your best friend. And I'm
If you
wondering,
get
where
the right
have you
one.
been all my life? Like, do I need to move next door to you in Fullerton? I'm like, what the heck,
Well, we're
I need a
friends. You
tiny
can
house
come
over
to me
there,
anytime.
or a
You can
mobile home
come to
over
me.
there. But
Yeah.
the other thing is, I want to ask, because I know we're coming to a close here. For those that are newly diagnosed, what would you want to say to them? I think that's going to be, obviously you're going to be in the book. I'm so excited about that. So if you didn't know that, I definitely want to give you a chapter in the book, because I think this is so good.
Oh.
What would you say to those as we close that are newly diagnosed? Because I'm sure they want to know, Dr. Rhonda, what do I do with all of this? And I want you to, those that are newly diagnosed and also the caregivers, what would you say to them?
Yeah, I would say for people that are diagnosed, that you're not damaged. Just take it one day at a time and focus on the positive. Remember gratitude. Gratitude is so important, and it doesn't take away from the pain. We're acknowledging the pain. We're not shoving it under the carpet, but remembering, try to every day say 3 things that you're grateful for. And, for my patients that don't walk, I tell them, well, at least you don't have a brain injury. And for the people that have a brain injury, I said, well, at least you can walk. So try to find some things that you can celebrate about
Yeah.
yourself and others.
I love
Yeah.
that.
And then,
I think writing down wins, like you're saying, and like, really documenting those wins every day. Celebrate. That's beautiful. Okay. What was the other
yeah.
one?
Oh, no. And I was just going to say, yeah. And remember, you're not alone, that there are other people like you mentioned. There's famous people that have this, and they have gone on to do amazing things. And so don't let it stop you and don't let it define you. If you have abilities and gifts and talents, focus
Mhm.
on those gifts and talents and don't let it define who you are or hold you back.
Wow, I just love that so much. Okay, we got 5 minutes and you got to go to your patients. What have we
Okay.
not covered today that you feel like would be so valuable to those that are listening? And is there anything that you would want to say about mindfulness, or anybody understanding this that doesn't understand what epilepsy is? What would you want to say to them, to the general public, I guess, that don't know what epilepsy is?
Yeah, I think we have to have compassion. Sometimes people don't really understand until they go through it themselves. And I
Mhm.
do hear that a lot. I will hear I've had people that have had very traumatic experiences happen to them with physical injuries and things, and they'll say, "Wow, I was so uncompassionate towards others until this happened to me." So try to just meet people where they are. Some people will be very understanding, and some just don't get it unless it's happening to them. And, choose your friends wisely, and but definitely don't hold it in and don't isolate as much as you can. I know when I say don't, then people want to do it more, right? Try and self-care, please. Self-care is so important, because if you don't have self-care and you're under stress all the time, it will come back in the form of like an autoimmune disorder and things of that sort. And we don't need more sick people. We don't need the caregiver to be sick too. So please take care of yourself and know that you are a lovable person, regardless of whatever you're going through. You are lovable and you are worthy of happiness.
Amen. And you are a Messianic Jew. I just want to say that. And we love you so much. And you are a woman of faith, of great faith. You have a beautiful family. And where can people stalk you? How can they get your services? And can
Oh,
they also become your patient, even if they're in other states, or even out of the country?
oh yeah.
Can they do that?
Well, right now I'm only licensed in the state of California.
Okay.
Some states allow, temporary
Mhm.
therapy, but I'm not, it depends on the state, but for the most part, it's California. I do
Okay.
Zoom, so it's all up and down the state. I do
Mhm.
have a wait list right now, but I did hire somebody. I have 2 people that work under me, and one of them has some openings right now, and I'm supervising them. So, or you can get on my wait list. But if you want to look for me, I'm on Psychology Today. I'm also on the EMDRIA website. And even though I'm on Zoom, I do have 2 locations in Pasadena and Fresno that are listed, but it's welcome to anybody in the whole state. So feel free to reach out to me. And if I can't help you, I'll try to put you in touch with somebody who can help.
Yes,
Yeah.
or Michael Hall. We can go and get a place next door to Dr. Rhonda
Aw.
and be her neighbor. I'm wondering why I
Yeah.
didn't do that 30 years ago or 20 or even
Aw.
5 years ago, but that's okay. I'm moving into your area tomorrow. So I
That's
love you so
awesome.
much. You have been such a
Yeah.
blessing. You know you have to get to your next patient. We cannot wait to have
Aw.
you back. I would love for you to have a conversation with Michael Hall, our producer, around suicide and also with regard to men and the stigma. So
Mhm.
please, let's have you back. Please say yes to that. I know how busy you are. You've got a wait list, but you missed your jazzercise class for us and all this other
I
stuff.
did.
Great.
It's
So
okay.
we love you
Yeah.
so much. And I cannot wait to see you soon in person and just give you another big hug. And thank you so
I look
much
forward
again
to
for being
that.
with us. Okay.
Yes. It was
Okay.
good to see you.
God
You're
bless
doing
you. God
fantastic
bless
work here.
everybody.